Thank you, everyone. I apologize if parts of this are a little bit repetitive from earlier, those in the earlier session. Hopefully you'll still find value in the presentation. For those of you that aren't familiar with the Ontario Health Quality Council, the Ontario Health Quality Council is an agency of the Ministry of Health and Long-Term Care, and its mandate is to report on the quality of care and services in publicly funded sector, as well as to support quality improvement. And recently, with the Excellent Care for All Act, our mandate has been expanded to include such things as supporting the adoption of clinical practice guidelines. In terms of resident satisfaction today, I'm going to speak about the Ontario Health Quality Council's role in two avenues. The first is public reporting. The Ontario Health Quality Council's framework for a quality healthcare system comprises of 9 attributes. This is adopted from the Institute of Medicine. And you'll note that one of our attributes is resident-centered care. And we define resident-centered as healthcare providers that should offer services in a way that is sensitive to an individual needs and preferences. So in this capacity, the Ontario Health Quality Council would like to expand its measurement of resident-centered in the avenue of resident satisfaction. As well, with the Long-Term Care Home Act, that requires homes to conduct annual resident and family surveying, as well as act on the results of their survey, the Ministry has tasked the Ontario Health Quality Council with recommending how this should be implemented. So today I'm going to speak on both of these areas. The first relating to public reporting and resident satisfaction. So why is public reporting resident satisfaction important, and what quality improvement value would it have for the homes? And also, how do we measure long-term care satisfaction in a valid and reliable way? And the second, going back to the legislation or the act, is to update everyone on our process for recommending how to implement standard resident satisfaction surveying in Ontario. So, in relation to the first point, looking at public reporting and resident satisfaction, this slide outlines 2 snapshots from the existing public reporting website. And these are clinical indicators, but if we imagine that these are resident satisfaction related areas, so for example, you had themes such as food or choice or autonomy, and then indicators related to that, you can see that we would be able to compare within our home. So this slide outlines measures within a home to see how am I doing within my home in different areas related to a provincial average, and what are the prime areas that I should focus my quality improvement areas on. And secondly, by having all homes report in one indicator, we can look within the homes to see what range of values are possible and what are homes doing for quality improvement in that area. And as we move forward, to be able to establish benchmarks and standards to strive for. The Ontario Health Quality Council's goals for public reporting resident satisfaction include to be able to compare results across long-term care homes and over time, as well as to be able to report understandable and usable comparative information for prospective and current long-term residents, but also for the long-term care providers as well. So to be a tool for the long-term care homes as well. And related to this is to support quality improvement by sharing ideas for quality improvement, posting quality improvement plans. But in order to get to that point where we can publicly report resident satisfaction or use resident satisfaction for quality improvement, we need a standardized process. So not just one tool, but also a process that would support being able to publicly report information in a valid and reliable way. So what are the challenges in implementing a standardized process in Ontario? If we look at the literature, there's 3 dominant themes that seem to point out. One relates to the population that we're serving. Second relates to the actual questions that we're going to ask, the instrument that we're going to use. And the third is the process that we implement. And so I'm just going to address each of these a little bit more in detail and support some of the evidence around maybe better approaches to addressing these. So if we look at population, for example, given the wide spectrum of cognitive ability in the resident, so actually, if I take a step back, how many people in this room do annual resident surveying of any kind? Keep your hands up. Okay, and keep them up. And how many use a questionnaire? Drop your hands if you use a questionnaire. So we can see right there that nobody in the room does in interviews. Put your hands back up if you did the survey. How many do just family? Drop your hands. Residents and just residents, drop your hand. Residents and family. Okay, so we can see that there is a wide variety in how we are doing resident surveying in our homes in Ontario right now. And so for us to be able to understand the results that each home is getting, landing on a standardized process for doing that supports being able to compare our results and understand how we're achieving the resident satisfaction outcomes that we're obtaining. So now if we go back to the population that we are surveying, who do we include? Do we include residents of all cognitive abilities? Do we only focus on certain levels? Do we include family members? What about people with different languages and different cultures? How do we address their needs? If we look at the literature, we know that family members do not appear to be a good proxy for residents. Rather, they are a separate stakeholder participant group and have a different perspective on what is important in long-term care. And I believe Dr. Wochus will touch on this in his presentation. And we also know from the literature that health status, depression, the age, they can impact satisfaction responses. If we take the case of Chow et al. In 2003, he noted that older long-term care residents reported higher satisfaction levels. So these are all things that we need to consider as we move forward. If we focus on the instrument, so what are the questions that we are going to ask in all homes across the province? Common areas, topic areas that are included: environment, meals, treatment, caregivers, activity, trust, security. These are known to us. But what are the exact questions that we're going to ask? And what are the range of question items? We need to be considerate of the burden that we're placing on our long-term care residents. The literature, a review of the literature shows a range of questions from 10 to 62 questions are being used in resident survey tools. But we also know that as we add on to the number of items, that we lose complete response rates. In terms of process, what kind of mode are we going to use? We touched on this already. We know that in-person interviews provide more rich information and support higher response rates than doing a questionnaire survey. What sample size are we going to use? We need to have the right number of residents reporting their resident satisfaction for it to be valid and reliable to post publicly, as well as to be able to measure any changes that are happening in the home. The sampling process. We see in the literature a wide range of inclusion and exclusion factors, and so that I mean who is allowed to participate and who isn't. Certainly the goal is to have as many residents as possible be able to provide information about their experiences. But how do we account for things like cognitive ability? How do we make sure that residents are willing to participate and address issues such as language barriers? This slide outlines the Ontario Health Quality Council's journey along recommending how to implement resident satisfaction surveying. And it starts back a few years ago with literature review and environmental scan, as well as a pilot study that was done at the University of Toronto by Dr. Wochus, and consultations with the Ministry of Health and Compliance. From that, we landed on draft recommendations and presented them into the sector. So we met with the associations, we met with residents' councils, family councils, concerned friends to get their input on how we should recommend implementation of this. As well as we went to the homes and tried to gather any tools that are existing and see how they are implementing the process in their own homes. So this is where we are right now. We've revised the recommendations based on that input, and the steps to move forward is, given the compliance transformation changes that are happening right now, is to meet with compliance and see, and I'll touch back on this later, how can we align with their activities? Once we land on those recommendations, we will pilot test that to make sure that it is a valid and reliable approach. So where are we right now in terms of what we're recommending? What we're recommending right now is that residents receive in-person interviews and that family members at this time do a mail questionnaire. And that for homes with a second dominant language, that the survey, the interview be translated for that language as well. The instrument that we're recommending is the NHCAPs survey, which I'll go into further detail, and that this be modified in relation to what compliance tool we'll be using. As well, we want to add additional items that are relevant to the homes in specific areas that they could drill down into quality improvement ideas. In terms of a process, implementing a standardized process that we can evaluate on an iterative basis to improve upon, and a sampling strategy that includes an adequate sample size, encourages as many residents as possible to participate that are willing, and residents that have resided in the home for at least 30 days. And I think so this is why in-person interviews, I think I've touched on this. They allow more residents to participate, and the family members are not a proxy. In terms of the NHCAPs, the Nursing Home CAPS instrument, this instrument was developed by the Agency for Health Research and Quality in the United States through a series of iterative resident focus groups. So we know that the tool is coming from the resident's voice, as well as it contains key drivers of resident satisfaction. The only residents excluded are those that are comatose, that are automatically screened out. It also uses different response categories. So it includes a Likert and also a 0 to 10 point scale. And it has been used in Alberta as well. So as we move to align with other activities in the sector, this tool supports that. These are some of the key domains that the instrument covers. So dignity, comfort, enjoyment, spirituality, relationships, privacy, functional competence, autonomy, meaningful relationships. So these are all key areas that we also see in other resident satisfaction surveys as well. And just to give you an example of more at a question level would be things related to, does staff come quickly when needed? Do you have help with your daily routine? So I spoke briefly on aligning with the sector, and so I wanted to present this as a high level of how we will modify this, or how we're looking to modify this tool. So you can see that the outer circle is the CAPS tool. We're looking to see what questions compliance are asking of the residents and how we can make sure that we align with that. And then what additional items would the homes like to add on that would identify key areas or more information about quality improvement. And again, the idea of implementing an ongoing evaluative process so that the interviews, after the interviews take place, the data is analyzed, public reporting, but that the implementation process is continually being revised and modified. In terms of next steps, I think I spoke to this, finalizing the recommendations, conducting a pilot test, and then providing the final recommendations to the ministry. Future directions for public reporting in satisfaction is the ability to benchmark, compare with other homes, identify priority areas for quality improvement, and examine the relationship between quality indicators and resident satisfaction. Thank you.